My name is Brandy Babin. I'm the Vice President of Clinical Services for Mana Health Partners, and I was asked to give a brief informational video based on the PhQ2-9 and the successes that I've had in utilizing this for new admissions to assist the MDS coordinators. And so I'm going to talk about the how, the why, and then the impact of doing it correctly. So our goal is specifically to ask the questions directly as they're written so that the tool stays valid. We want to clarify the meaning in a neutral way so the patient understands what the question is asking. We want to score based on the patient's final clarified response and then make sure that there's clinically interpreting the cause of that. So whether it's a medical condition, situational stress, grief, or actual depressive disorder. And the PHQ score tells us what the patient has been experiencing, and our clinical assessment tells us why. So when I go in and I talk to the patient, I explain to them, I'm going to ask you some questions about your mood, sleep, appetite, and energy over the past 2 weeks, including and during your hospital stay. Many people feel tired, discouraged, and overwhelmed after being sick. So just answer based on what your days have actually felt like. For each answer, we're going to choose not at all, several days, more than half of the days, or nearly every day. And I actually have a pre-printed form for them so that it's an 8x10 and it has the choices, and then they can point to it or look at the choices and then make their answer. So in part of the wording, if any part of the wording is unclear, then I ask them to tell me, and then I'll explain it without influencing their answer. So that's what I tell the patient before I even start the PhQ2-9 assessment. So the official question I have to ask verbatim. I am allowed to do a neutral anchor or a clarifier, not leading, but neutral. And then examples of what that symptom may or may not look like over the last 2 weeks without telling them if they have it. And this keeps us survey safe. So asking them the correct questions exactly how it's written. So it prevents confusion for cognitively impaired or medically ill patients. The patient's fresh out of the hospital. They don't necessarily understand the time frame. They don't understand what the question is really getting at. Sometimes they answer too quickly and they don't have a chance to think about it. And they focus on now, like how they feel now. And most of them are really glad to be out of the hospital. And so they don't reflect on those past 2 weeks. So we want to reframe the time window. We want to clarify definitions. We want to ensure comprehension before they answer, which improves accuracy and not manipulation. So the PhQ2-9 gateway are the first two questions. So is there little interest or pleasure in doing things? Or is the patient feeling down, depressed, or hopeless? If both answers are questioned as 0, not at all, then a full PhQ2-9 is not required. You just do the first two answers. Per CMS, the MDS depression interview coding and standardized PhQ2-9 administration rules state a negative PhQ2 means that there are no further questions that need to be asked. It screens out why you would even need to do additional questions. It indicates there's no depressive symptoms at all over the past 2 weeks. And 3 through 9 questions aren't really necessary and don't need to be put on the MDS. However, and I say however, if either question 1 or 2 has a positive answer, so anything greater than 1, then the facility must complete the entire PhQ2-9 with questions 3 through 9 included. So question number one, this is kind of how I approach this. And I really take the effort to have this written down. I make eye contact with the patient, and then I have my card with the answers, which are not at all, several days, more than half of the days, or nearly every day. And so that's sitting right on their table. So I ask them, over the past 2 weeks, how often have you had little interest or pleasure in doing things? Now, we are allowed a neutral clarifier, not to manipulate, but neutral. And so I say things like, this refers to things you normally enjoy, such as watching TV, talking with family, meals, spiritual activities, or hobbies. Think specifically over the last 14 days, including, this is so important, including your time in the hospital. Some people feel too tired or overwhelmed to do much after a hospitalization, while others feel about the same as usual. And so then I'm putting clarifiers, which are neutral clarifiers, to have them answer appropriately. They understand the question. I haven't changed the question, but I have clarified in a neutral manner. I don't say to them, remember in the hospital when you didn't want to watch TV or when you didn't want to do anything and you just laid around? That's not what the point of this is. To follow CMS guidelines per the RAI manual to get the right answer for your MDS, you can do neutral clarifiers without leading or misrepresenting the question. So the second question, first one and second one are the most important. Do you get a positive on the first question or the second? The second one is depressed mood. So then I ask them the exact question. Over the past 2 weeks, how often have you felt down, depressed, or hopeless? By this, we mean feeling discouraged, low, emotionally drained, or things like which are harder than usual. Please consider the past 14 days, including how you felt during your hospital stay. Some people feel discouraged while recovering, and others do not feel emotionally effective. So if they answer one or two, the first question or second question, with even one positive answer, then you're going to move over into question number 3. So that's regarding sleep changes. So the official text, you're going to read word for word. Over the past 2 weeks, how often have you had trouble falling asleep, staying asleep, or sleeping too much? The neutral clarifier is this includes difficulty getting to sleep, frequent waking, waking too early, or sleeping more than usual. That's important when they're in the hospital because usually somebody is in the room every 2 hours or every 4 hours checking blood pressure. Now, we don't tell the patient that. We have to be very neutral in how we ask the question and how we clarify the question. However, it's very important that we do put that neutral clarifier in there. The 2-week anchor is super important because it's over the past 2 weeks. So if they finally got into the nursing facility and they're sleeping good over the last 3 days, that's where you want to bring in. Think about your typical sleep pattern over the past 14 days. So hospital routines, noises, or medical conditions sometimes disrupt sleep. Sometimes sleep remains normal. And then we're going to get their answer. The fourth question is about fatigue and energy. And so you're going to read it exactly as the question states. Over the past 2 weeks, have you felt tired or had little energy? And so this refers to physical or mental energy, feeling worn out, drained, or sluggish. And we're going to focus the energy levels over the past 14 days. Some people feel weak or fatigued after an illness. Others maintain their usual energy. That's where you're going to get your answer from there. Appetite and eating changes. So word for word, over the past 2 weeks, how often have you had poor appetite or overeating. This includes eating much less or much more than your usual amount. Think about the past 14 days, including your appetite during hospitalization. Hospital food, nausea, illness, or recovery can change appetite, while some people notice no changes. Self-esteem, word for word, over the past 2 weeks, how often have you felt bad about yourself, or that you are a failure or have let your family down? This refers to general feelings of self-worth or self-judgment. Please consider only the last 14 days. Some people feel discouraged during recovery. Others don't have feelings at all. The next one, number 7, is concentration. So over the past 2 weeks, how often have you had trouble concentrating on things, such as reading the newspaper or watching television? Regrettably, that's the way you word that question. In real life, we don't read the newspaper anymore. Some people play on their phones or read a book, but we read it word for word because that's per CMS guidelines. So the neutral clarifier to that is this refers to difficulty focusing, following conversations, or staying mentally engaged. Think about your typical concentration over the past 14 days. Pain, medications, fatigue, or even illness can affect concentration, and sometimes people notice no changes. And then the question about psychomotor changes. Over the past 2 weeks, have you been moving more slowly or speaking so slowly that other people have noticed? Or the opposite, being fidgety or restless so that you've been moving around a lot more than usual? And your neutral clarifier is this refers to slowed movements, slowed thinking, or increased restlessness. Consider your typical pace and behavior over the past 2 weeks. Some people feel physically slowed while ill, others feel unchanged. And then the last question to the PhQ2-9 are the suicidal thoughts. Over the past 2 weeks, how often have you had thoughts that you would be better off dead or hurting yourself in some way? This asks specifically about thoughts, not actions. Please consider only the last 14 days. Some people have brief or passing thoughts during illness or stress, and others have none. So then we're going to go and interpret the scores. So if you don't have any for PhQ2 1 or 2, then your score is going to be a 0 and you're not going to proceed any further. A 1 or 2, maybe there's some depressive symptoms. We're going to continue on. 3 to 6, is there a high likelihood of depressive symptoms? And then anything over 10 is moderate. Now, does that mean they're depressed? Does that mean they need an antidepressant? No. We report that to the PMHNP or the psychiatrist, and then they can assess the patient additionally. During hospitalization, if you have ever been hospitalized, you realize how traumatic it is and how we may answer some of those questions. And over the next 14 days of being in the skilled nursing facility, getting food, being on a regular schedule, having therapy, having people involved in their care activities, your total change of feelings, behaviors may be different than when you were very ill and in the hospital. You're going to ask questions without leading. The neutral clarifiers are really important. Don't suggest a problem exists. Remind them it's over the last 14 days. So if they say over the last 6 months it's been worse, or the last 3 months it's been worse, remind them that it's a 14-day look back. You can provide non-leading examples, but avoid because you were in the hospital And don't validate answers until after the scoring is complete. So once you get your answers, then you can ask additional answers on top of that. And so if your score is 10 and they said they didn't have any problems sleeping in the hospital and that was their answer, you can ask them, did you have any difficulty sleeping while you were in the hospital? Oh, yes, I did. Did you get much sleep during the hospital stay? Not hardly at all. Have you been sleeping well since you got here? Not during the first night. It was very difficult to adjust. You can add all of that as notes, as a progress note. It just doesn't affect the score. So remember, we have to follow CMS guidelines. So the PhQ-9 has to be read directly as written. You are allowed to use neutral clarifiers only. The first answer has to be scored without re-asking or shaping or guiding them into that answer. The education, clarification, and discussion can occur after scoring to support the care planning. And then if PhQ2-9 is 0, then we wouldn't go any further than the PhQ2. If it's greater than 1, we're going to score. And we're never going to skip the PhQ-9 when the PhQ2 is positive. If we have a positive, we have to finish that to find out where their depression is actually coming from. As part of the Aviata team, the Avir team, the Mana team, I am always available for any additional questions that you may have. Again, my information is here. You can reach out to your regional nurse consultant, your director of nursing, the MDS consultant. Any of us have the correct answer on how to do the PhQ2-9. But remember, it's not just asking a direct question, but it's sometimes also using neutral clarifiers to express what the question actually means. So I hope this was helpful. I hope this changes the way you do your PhQ2-9 in the future. And I hope that as we go forward, we're able to identify things earlier in a patient's stay so that we can potentially get them any care that they need, any kind of therapy that they need, or even any medication management, even if it's on a short-term basis. Thank you for your time. Your time is very valuable. I appreciate it. And don't hesitate to reach out if you have any questions. Have a great day.